Hi, my name is Emma Holtzman, and today I will be discussing the biopsychosocial approach to psychological disorders. There are many factors to psychological disorders. Of course, there are the biological, psychological, and social factors, but today we will also discuss some cultural factors. The biopsychosocial approach states that the mind and body are inseparable. It also created the concept of the stress vulnerability model depicted below. According to Myers Psychology for the AP course, this model suggests that individual characteristics combine with environmental stressors to increase or decrease the likelihood of developing a psychological disorder. As you can see by this graph, the chances of developing a psychological disorder increases as stress increases. Also, genetic predispositions increase the likelihood of development as one would be more vulnerable to the disorder. Vulnerability and stress work hand in hand as a stressor can cause the biologically predisposed disorder to appear. This reflects the concept of epigenetics, as certain gene predispositions can express due to environmental factors. First, we will discuss the biological factors. As previously mentioned, genetic predispositions can increase the likelihood of developing a psychological disorder. It is found that bipolar disorder is the most heritable psychological disorder, with the heritability rate being 70 to 90%, and schizophrenia is the second most heritable, with the rate being 70 to 80%. Also, a first-degree relative, which is a parent or sibling, with the disorder drastically increases the chances of developing said disorder. Also, brain structure correlates with psychological disorders. It is found that more activation in the amygdala has been found to be correlated with anxiety disorders. Contrastingly, inactivity in the amygdala is found to be correlated with PTSD. Interestingly, it is found that people with schizophrenia have more gray area in some parts of the brain. It is also found that those with schizophrenia have less activation of the frontal lobe and abnormalities in the amygdala. As you can see by this scan comparing a healthy brain, a brain at risk, and a brain with schizophrenia, the brain with schizophrenia has much more gray area than that of a healthy brain. We will now look at the psychological factors. For starters, extremely stressful situations and trauma can cause psychological disorders to arise. As for stress, someone who has a loved one battling a deadly disease can show an increase in anxiety and depression. For someone who already has anxiety or depressive disorder, stress can worsen the symptoms. Trauma can lead to post-traumatic stress disorder, anxiety, or depression. Interestingly, women are at higher risk of developing a disorder after a traumatic event. After 9/11, PTSD was the most common psychological disorder that victims obtained. It was found that 20% of victims of the attacks suffered PTSD for 5 to 6 years. Finally, we will be discussing the social-cultural influences on disorders, which include cultural expectations, family influence, and social media. First, we will dive into cultural expectations. People in Western society, especially white people, are much more likely to report mental health struggles and enter therapy. Certain cultures and religions have expectations or stigmas that may limit one's ability to speak about their symptoms. Having a mental disorder is frowned upon in multiple cultures, also causing speaking out to be harder. These can worsen symptoms, ultimately causing the worsening of psychological disorder. Also, accessibility to treatment can be limited in varying cultures, which can also increase the likelihood of severe psychological disorders. Family can have a big impact psychologically. Mental or physical violence could lead to long-term psychological disorders like PTSD or depression. Family pressures for perfection, or a vision one's parents has for their child, could also influence the development of psychological disorders. For example, a parent can have an expectation for their child to be skinny, causing them to promote possibly unhealthy weight loss behaviors for their children, ultimately leading to the development of an eating disorder. Family struggles like violence or divorce can also lead to the development of a psychological disorder. And of course, as previously mentioned in the biological approach, a family history of psychological disorders can increase the likelihood of development. Social media has had a significant impact on the world in the last 2 decades. Though it has brought much positivity to the world, it has also brought many negatives, including romanticization and glorification of psychological disorders. Let's take, for example, the recent rise of the coquette aesthetic that has entranced many TikTok users. The aesthetic focuses on pink, lace, hearts, Dior and Chanel perfume and makeup, and Lana Del Rey's music, and other dainty-looking things. But behind all of this pink comes a darker part to the aesthetic that promotes eating disorders. Many people who subscribe to the aesthetic are often extremely thin and promote unhealthy weight loss tactics and romanticize eating disorders in order to maintain their dainty look. Those who want to join the aesthetic often feel pressured to take part in these eating disorder habits. Take a look at this screenshot from one coquette user's TikTok. It says, "Tips on how to lose weight, desperate for a change. Diet and to maintain a pretty face." The caption, not depicted here, says to be extreme with suggestions. The comment section was filled with people promoting a dangerously low-calorie diet and one that even said to just chew gum all day. These starvation diets reflect and promote anorexia nervosa, a severe eating disorder. Thank you so much for watching, and I hope this video helped you to understand some aspects of the biopsychosocial approach to psychological disorders, as understanding these factors is crucial to understanding these disorders.